Hi, I'm Dr. Abe. I'm an MD and cannabis health coach, and I'm here today to answer your questions about CBN and how it affects your body. Cannabinol, or CBN, is one of the main players in the cannabis world, alongside its famous parent, THC. But unlike THC, CBN isn't a party animal. It's actually what happens when THC ages a bit on the plant, or if your dried weed at home gets left out in the sun. Fun fact, CBN was actually the first cannabinoid ever discovered, way back in 1886. Now, while some people say that CBN gives you a mild buzz, others swear it knocks them out for a good night's sleep. That's why lots of people with insomnia reach for CBN oils, tinctures, or gummies. Science hasn't totally figured out all of its benefits yet, but CBN shows real promise, especially when it teams up with THC. Who knows, it might even have even more tricks up its sleeve. CBN is one of my go-to add-ons because I've successfully used it to help people with their sleep and improve their appetite in cases like cancer, dementia, and anorexia. For instance, using CBN helped one of my anorexic patients get restful sleep and ease her daily anxiety, and she achieved her weight goal of gaining 30 pounds. CBN could also be useful for helping people with many types of pain like musculoskeletal, fibromyalgia, and temporomandibular disorders, or TMDs. Limited research shows CBN could help in a wide range of painful, inflammatory, and neurological conditions like dementia. I find that CBN is more effective for things like pain, sleep, and appetite when it's combined with THC, an idea that's also supported by research. CBN is commonly used for improving sleep and appetite, so it stands to reason that taking CBN can also make you feel drowsy and more hungry. If you're trying to avoid these two common effects while trying to relieve other issues, then it's probably best to reach for a different cannabinoid like CBD, CBDA, or THCV. The other side effects of CBD aren't fully known yet, but large amounts of CBN, like in the range of 50 to 100 milligrams or more, may cause a slight or mild high. Small to moderate doses of less than 20 to 50 milligrams of CBN won't get you high. But there may be weakly psychoactive effects of CBN when you take it in larger doses. CBN is about 10 times less strong than THC is, which may be why study participants rate CBN as a mild and enjoyable experience. And it explains their shared benefits and side effects like feeling sleepy and hungry. As far as we know, CBN is well tolerated and generally safe for people. There are very few studies that specifically look at the side effects of CBN. Most are small and outdated, but they know that CBN by itself doesn't cause any significant side effects. So if the product you buy only has CBN and no THC or other cannabinoids, then technically you shouldn't experience any negative side effects. If you take CBN, you can expect to feel drowsy and a little hungry. Often when I recommend CBN to my patients for sleep, they report improved sleep and tell me that the next day they also feel a little hungrier for breakfast and may eat a little more than usual. Usually these side effects are the therapeutic effects that my colleagues and I in the medical community are aiming for. CBN is metabolized in similar ways to other cannabinoids, and therefore many other common medications. If you take prescriptions like anti-seizure drugs, blood thinners, antidepressants, anti-anxiety drugs, beta blockers, antipsychotics, and steroids, then you should be careful about taking CBN. Most of the time, these drug interactions between cannabinoids and medications aren't significant outside of anti-seizure drugs. If you take these kinds of prescriptions or have specific health concerns, you should ask your doctor first before taking CBN. CBN is something I recommend to my patients when I notice a specific pattern of insomnia, pain, and low appetite that can be caused by a variety of conditions. In my experience, I have used CBN to help people recover after a stroke or with advanced dementia, cancer, or anorexia, where these particular issues are common. The best candidates for CBN usually have a combination of sleep, pain, and appetite problems. Patients with conditions like anorexia, cancer, chronic pain, anxiety, depression, and post-stroke care, Alzheimer's, and other dementias that can affect sleep, pain, and appetite could benefit the most from CBN. If you've used CBN, let us know about your experience in the comments. Or if you have questions about CBN, write them in the comments section and I'll try to answer them or point you in the right direction. For more information on CBN, visit the link in the description.